Therapeutic counseling techniques. These are the different techniques and interventions for some of the NCMHCE disorders. The first disorder that I'll be discussing is adjustment disorder. Some of the techniques for adjustment disorder include coping skills training, crisis intervention, psychoeducation, stress inoculation, solution-focused therapy, problem-focused therapy, DBT therapy. The next disorder is agoraphobic disorder. Techniques for this disorder include panic control therapy, exposure therapy, flooding, systematic desensitization, and imaginal. Alcohol use related techniques: cognitive behavioral, cognitive, cue exposure, urge coping, self-control training, brief motivational interviewing, stress, supportive expressive therapy, exposure prevention, homework, cognitive restructuring, maladaptive thinking, relapse prevention, problem solving, social skills training, interpersonal therapy, ITP. Next disorder I'll be discussing is anorexia nervosa. So some of the techniques for anorexia nervosa include Maudsley model, family organization and interaction, facilitate eating and weight gain, parables, paradoxes, personal authority, rationalizations, psychodynamic interpretation, and homework. Attention deficit hyperactivity, behavior, parent training, contingency management, which include teacher reward, point system, timeout, family therapy, social skills training, anger management, communication skills, recognition of nonverbal, time management, BBT, behavior classmate management, summer-based treatment programs. Autism spectrum. Techniques include social development, focusing skills, sensitivity to cues, modeling communicative skills, predictable play. Bipolar disorder adults. Techniques include medication, which is the first line of techniques for dealing with bipolar disorder, family psychoeducation, family-focused psychoeducation, interpersonal therapy and social rhythm therapy, IPSRT with social rhythm, circadian rhythm, and family-focused therapy. Body dysmorphic disorder. Techniques include verbal expression and stress management, bulimia nervosa, cognitive behavioral therapy, routine eating, structured eating, monitoring of food intake, expose-based methods, weighing, cognitive restructuring, food diaries. Conduct disorder, social skills training, relaxation exercises, impulse control, negative talk, family therapy, active attention skills, active ignoring skills, parent training, setting limits, physical affecting, attention, planned ignoring. Depression, bibliotherapy, cognitive therapy in group format, interpersonal psychotherapy, ITP, problem solving. Delirium, support for caregivers, relaxation training, coping skills, eating disorders, mindfulness and acceptance, cognitive behavior, routine weighing, food diaries, exposure, structured eating, behavioral experiments, factitious disorder. Reduction in self-interest behaviors, coping skills, generalized anxiety, GAD, which is cognitive restructuring, relaxation training, emotion regulation, exposure techniques, problem solving, muscle relaxation, guided imagery, diaphragmatic breathing, expressive therapy, systematic desensitization, CBT, ACT, cognitive. Insomnia. Techniques include CBT, sleep hygiene, sleep diary, relaxation exercises, muscle relaxation, autogenic training, sleep scheduling, sleep restriction, paradoxical intention, thought stopping, and problem solving. Intermittent explosive disorder. Techniques include stress management, impulse control, distraction, relaxation training, systematic desensitization, habit reversal, problem solving, real life conflict situations, major depressive disorder. Cognitive techniques include cognitive, CBT, interpersonal psychotherapy, mindfulness based cognitive therapy, behavioral couples therapy, BCT, exercise therapy, light therapy, medication. Marital distress techniques include problem solving, BMT, contracting, communication training skills, obsessive compulsive disorder, CBT, ACT, exposure, cognitive restructuring, mindfulness, response prevention, ERT, acceptance, diffusion, self as context, present moment awareness, committed action, habituation, parent intervention, relaxation training. Oppositional defiant disorder. Techniques include social skills training, problem solving, active attention skills, active ignoring skills, parent training, which includes setting limits, physical affection, attention, and planned ignoring. Panic disorder. Techniques include panic control therapy, psychoeducation, relaxation training, cognitive restructuring, cognitive reappraisal, controlled breathing, diaphragmatic breathing skills, in vivo exposure, imaginal exposure, i.e., symptom induction exercises, exposure therapy, interceptive exposure, mindfulness, brief supportive therapy, ACT. Paraphilia disorder. Techniques include stress reduction, aversion therapy, covert sensitization, thought stopping, extinction, cognitive restructuring, contingency management, aversive conditioning. Personality disorder. Techniques include psychoeducation, cognitive behavioral, DBT, schema therapy, attachment therapy, mentalization, phobic and anxiety. Techniques include in vivo, imaginal, behavioral exposure, bibliotherapy, ACT. Post-traumatic stress disorder. Techniques include psychoeducation, prolonged exposure therapy, imaginal exposure, stress reduction, exposure therapy, stress inoculation, adaptive coping, DBT, ACT, eye movement desensitization, reprocessing, EMDR, stress reduction, schizophrenia. Techniques for schizophrenia include cognitive behavioral social skills, problem solving skills, social skills training, family psychoeducation. Separation anxiety. Techniques include anger management, parent management, and problem solving. Sexual disorders, psychoeducation. Couples counseling, progressive relaxation, sensate focusing, systematic desensitization, stimulus control and scheduling, cognitive restructuring, communication skill training, social anxiety disorder. Techniques include exposure, cognitive restructuring, exposure combined with cognitive restructuring, social skills training, attention, focus training, homework, applied relaxation, anxiety management, mindfulness, flooding, in vivo, imaginal, psychoeducation, exposure to fear situations, anxiety coping skills, problem solving, cognitive behavioral models, cognitive group therapy, social effectiveness therapy, SET, interpersonal psychotherapy, IBT. And then the last disorder on there is somatic symptom, and the techniques include relaxation exercises as well as sleep hygiene.